Thank you. Thank you very much, Giuseppe Umana. And I thank again John Bennett for organizing this fantastic meeting. I apologized as I told you a couple of minutes ago that I'm in countryside, and Santino Tomasi, my former co-worker, found me here in the green without internet. I have just my smartphone here. But I promise you that I'm very interested in the two presentations, even yours and from the group from Singapore, is incredibly stimulating to teach anatomy, to continue to learn and teach anatomy. I retired from Salzburg University in March, end of March this year. And I tell you that I'm reading books more than before. I go back to old books, to the oldest one, to the really old books from let's say in my opinion, greatest anatomist, neuroanatomist of all time. His name is Henri Duvernois. He died a couple of weeks ago at the age of 93 in Besançon in France. If you look at his books about brainstem vessels, drainage of brainstem, hippocampus, or the cortical anatomy, it's a gold mine. And if I have to review papers in neuroanatomy from the neurosurgical community, I know that if there is no citation of Henri Duvernois, I know exactly that this is not a paper worthy to be published. So let's say your work, it's great, it's fantastic, but it remembers me when the three-dimensional MRI came in the 90s. I was a young resident before I moved from Italy to Germany and then to Scandinavia, and this was a kind of wonder for us. And the same is now with your technique. Your technology is amazing, it's great, but the people who uses this technology has to be prepared in terms of knowledge, of really, really high sophisticated knowledge in neuroanatomy. And I told all my people, I told always my former residents in Munich, Germany, and then also in Salzburg, please start in the laboratory. Neurosurgery starts in the laboratory, as one of our great pioneers, Professor Yassagil, showed us all the time. You have to dissect 400, 500 brains before you understand brain anatomy. So let's combine your fantastic technology and what I try hardly at the moment to combine all the knowledge we have, the books from Stephen Stilwell, Henri Duvernois, from Seger, from Albert Roton, of course, from Yassagil, from Economo, Clara, etc. So on. There are about 40, 50 textbooks you have to read, you have to understand, and then let's combine this. But this is, of course, a very time-consuming story over years with your fantastic holo technique. So I'm very enthusiastic about your technique. Congratulate you, Giuseppe Umana. Congratulate the friends from Singapore. And I thank again Professor John Bennett for organizing this fantastic meeting. And I apologize again, my very, very small technique. Smartphone. I promise you, the garden now is the garden in the countryside now. It's plus minus. It's organized. It's in the region of Bamberg, between Munich and Frankfurt. We have a house, and then I will be back to Munich in a couple of days. And there, my infrastructure, my technical infrastructure, of course, it will be okay. Thank you again, and have a nice Sunday. And I give back to Giuseppe Umana.
You're welcome, Professor. Ottavio, Could you talk about this project that was started by Professor Winkler some year ago, and then we joined it in a later stage?
Hello. Hey, thank you, Giuseppe. Thank you, everyone. Hi. So I hope you can hear me well. So yeah, just I want to spend the 2 words about this work. So we did together with Professor Winkler, with you, with the other colleague. And then we can talk, of course, about this project regarding our lab and then the combination with these fantastic new tools and technology like augmented reality and artificial intelligence. So if you want, I can just spend 2 words about the work, the paper, just because I think this is interesting to see. So this is just now we move to the past. So because after this futuristic presentation, excellent and very fantastic. So we have an old-fashioned study, if we can say so, about the importance of the cortical vein. And this is important in relation with the brain shift, because everyone knows the importance of the brain shift, especially you have to to fight sometimes with the brain shift when you are in the operating room. We have so a lot of tools. So then like the neuronavigation, of course, we use today also the routinely the ultrasound, the intraoperative ultrasound so far. But I think so sometimes for us, it's difficult when we have a big brain shift, and then of course this is not possible to realize and to have a real-time picture of this situation if we would like to combine with the preoperative imaging. The study, this is interesting study, I think, about the importance of the cortical vein, the surface vein, as landmark for neurosurgical practice. And then, so we did that with a combination with the sequence T1 MPARAGE and with the 2D TOF angiography, because we can see respectively, so the cortical surface and the vein after injection of contrast. So in this study, we published in Frontiers in December 2020. So then we will see how we can combine with very easy tools. So like MRI, in this case was on 1.5 Tesla. And we combine this with a small software, then we use manually. So with the help of engineer and the physicist. And then we obtain this fusion imaging. I don't know if you can see a couple of pictures, but then we realized with this simple tool, not easy to use, but we can have a real-time picture or in the fusion of the preoperative imaging. So, and the real situation in OR in craniotomy patients. So we did in patients with tumors and in patients they suffered from therapy-resistant epilepsy. So just for example, yes, you can use the next one. So this is after when we have this combination, so we match and merge the pictures, so the MRI with intraoperative pictures, then we can use like a volume sculpting. These sculptures we obtain with more rotation, and then finally we can have a better view with less artifacts of the superficial aspect of the cortex and of course of the vein. And then we will see in the next picture, for example, this one. So you have a simple imaging here where you can see the venous representation on your left side, then you see the intraoperative representation, and then on the right side, you have the fusion of these aspects. And this is important because you don't have the problem with the brain shift. Or if you have is really minimal, this doesn't you don't have a problem during your operation and also in the preoperative planning. Then of course this is the old-fashioned technique, but it's a basis. I think you can, because if you know the anatomy you will never lost. So if you know the anatomy, and of course you can have the chance to have new and very futuristic tools like the augmented reality, I think that will be a great impact in the neurosurgical practice, but also, as Dr. Palmisano said, so I think for the education of the residents, because this is what we want. That is the project we talked with Professor Winkler, with Dr. Umana. This is our project for the future in our lab in Salzburg, because we have a laboratory that Professor Winkler developed this laboratory, a microsurgical neuroanatomy lab. Then I have the honor to continue the tradition, the legacy of Professor Winkler in the lab. And the idea is to have a really lab for microsurgical dissection, microsurgical neuroanatomy, and then we can combine it, these basis for every neurosurgeon with this new technology. And we can offer, that is our project, our dream, we can offer a fellowship program for people that are interested to learn the microsurgical anatomy in a 3D way, but also with the help of the augmented reality, in order to go to OR with more confidence, because it's not the same. So when you don't have a laboratory education, and then you are alone in OR, you are in the night without navigation or without tools. So, but you have your formation in the lab. So with a lot of tools, even if you are alone in OR, you know what you have to do, and then you will do properly. And that is important not only for us as neurosurgeons, but especially for the patients, because I think, once again, for us, it's important the patient outcome. That is our target. That is our goal. So this is what so I want to tell about this project. And please, if Professor Winkler will tell something more, or Dr. Umana, I will be grateful. So
maybe just one few words. It's great to have young people like Giuseppe Umana, like Santino Tomasi, with their very great tradition, humanistic education, and maybe that's the case why they come from Sicily, but great formation, education, and a great enthusiasm for functional anatomy. And this will be the combination of this fantastic, brand new and very interesting stimulating technology with a very sound knowledge about basic and functional anatomy. I don't talk about the minimum to pass the exam for both examination in every country in Europe or United States or Scandinavia. I know the different systems of neurosurgical training around the world, but I am talking about deep knowledge in anatomy. We are the unique person as neurosurgeon. We see the brain. The neuroradiologist, the neurologist doesn't see the brain. They just see images. We see the brain, and therefore we have the responsibility to know more than other people about brain anatomy, microanatomy. And I'm very happy that I can give this legacy and give this laboratory in Salzburg, because I moved away from there. I'm back to Germany and traveling around the world, but I'm happy to be in the condition to give Santino Tomasi at least the infrastructure of this laboratory from Salzburg. Thank you again, and have a nice evening. Thank you.